Hey guys, welcome back. Today I want to talk about strawberry legs. My name is Dr. Jenny Liu. I'm a board-certified dermatologist and welcome back to my YouTube channel. So strawberry legs, a funny term that you may or may not be familiar with, but this is very popular on social media as well as on magazines. And what it is essentially is actually a very common skin condition that is findings on your lower legs, most commonly on like the calf, on the shin, maybe even on the upper thighs. And you basically see these red and brown dots that kind of resemble the small black dots on a strawberry. What it is keratosis pilaris made worse by shaving, sun exposure, or overly aggressively exfoliating your skin. That then leads to hyperpigmentation that then turns into round dots on the legs. So let's briefly touch up on keratosis pilaris. I do have a separate dedicated video on KP and how to best tackle it, but keratosis pilaris essentially is a form of dry skin. And what's happening here is that the dead skin, because the skin is so dry, is not shedding or desiccating properly, and it's clogging up the hair follicles, the pores, if you will, leading to this appearance of bumpy skin. So some people also call it chicken skin, but also can at times be inflamed or look red in appearance. Common locations are the back of our arms, and I used to have this really badly when I was growing up. Thighs and the lower legs, which I still do a little bit to this day. When it's really bad, people even have it on their back, and it can even involve their face and can be quite inflamed. Keratosis pilaris, unfortunately, is not curable because by definition, it's a form of dry skin. And in essence, you kind of are born with the skin that you have. But it does tend to get better over time. We tend to kind of grow out of it, and mine certainly did. But for individuals that continue to experience this into their adulthood, there are certain ways you can care for your skin and products that you can put on a regular basis to really help to minimize the bumpiness, the rough texture, as well as the appearance. Now, when it comes to the strawberry legs, what's happening here, in addition to just the presence of keratosis pilaris, if the hair follicles or the pores are clogged by dead skin and then you're shaving over that, it can create additional trauma and inflammation and then post-inflammatory marks. And then it can maybe even be compounded by chronic sun exposure. So shaving certainly can contribute, and I'll share with you guys tips in a little bit of how you can remove hair on the lower legs and minimize strawberry legs. And then if there is active inflammation or even a little bit of, in addition to shaving bumps, but folliculitis too, that can also contribute to the appearance. And then on top of that, if you know you have keratosis pilaris and you're using the wrong type of exfoliants and being overly aggressive, for example, physical scrubs, that can also cause more inflammation and therefore worsening of hyperpigmentation and those brown dots. So if you have keratosis pilaris, you're prone to it, you have it, what can you do? Well, again, feel free to watch my videos for more extensive medication recommendations, but this is where using a body moisturizer with alpha or a beta hydroxy acid on a regular basis, and when I say regular, I say daily, if it's really bad, can be very helpful. And that is actually what I do. I used to have this super bad in high school. To this day, I will still use a moisturizer like Amlactin or, for example, Cerave SA Rough and Bumpy line. That certainly can be helpful. And remember, it's gonna take some time for that dead skin to get unclogged and for the appearance and that texture to improve. So don't assume that just using it here and there and using it a few times is gonna be helpful. This is gonna take time. I would say use it regularly as your body moisturizer for at least a couple months, and then you will start to notice improvement. And certainly if you are prone to it, using that regularly, may not be daily, but using it regularly can be helpful in maintenance and prevention. It is okay to use an alpha or beta hydroxy acid moisturizer as your body moisturizer, because not only will they help with the keratosis pilaris, the rough texture, but if you are more prone to just dry, flaky skin, even without the KP, it can help with that component. And certainly if you're of darker skin tone and you find your skin to be somewhat ashy in appearance, a moisturizer with alpha or beta hydroxy acid can be helpful. And also, if you are fighting hyperpigmentation on your body, whether that is from darkness from bites, from eczema, or say even if you have darker body fold areas, I've mentioned this before, alpha and beta hydroxy acid can be a very safe and great way to incorporate a less irritating treatment than say tretinoin, for example, on your body. And it's great at hydrating your skin and removing that dry, dead flaky skin that's sitting on top. The one thing I would caution you is that if you are expecting, if you're pregnant, you may want to look into more ingredients like ammonium lactate, or that is a derivative of lactic acid, and not use a beta hydroxy acid like salicylic acid, mostly because of the potential risk of absorption when you are using large amounts of the moisturizer on a regular basis. Like for example, one I've talked about before, like Amlactin. This is a great one. It's pretty creamy and rich, so great moisturizer to help with dry skin, but you have the addition of ammonium lactate that's going to help with the bumpy rough texture and the keratosis pilaris. Another one that I have shared in my previous video includes the one from First Day Beauty, their KP Smoothing Body Lotion with 10% AHA, and it's mainly like lactic acid here. This is also really nice because it's got urea and colloidal oatmeal and ceramides that also help to repair the skin barrier. Urea is also a great humectant that helps with dry flaky skin, but also you get a little benefit of licorice root. So certainly a great one to use, not just for rough and bumpy skin, but also if you have like uneven skin tone from like bites or something like that, the licorice root may help a little bit with hyperpigmentation. And then lastly, another moisturizer that I just been using recently that I really like is from Drunk Elephant, their t.l.c. Glycolic line. So there's one that's pink serum for the face. Basically, this is 10% AHA plus a little bit of shea butter. So a lightweight moisturizer with exfoliating benefits for the body if you're looking for another alpha hydroxy acid body lotion option. Also remember that the brown dots are post-inflammatory changes. So in the summertime, especially if you're going to be out and about in shorts and skirts or swimming and you're using an alpha hydroxy acid moisturizer, you're going to be prone to sunburn and as well as just increasing that sun damage. So make sure that you are using sunscreen on a regular basis to these areas to reduce the risk of sunburn, but also to help treat your hyperpigmentation, because the more sun your skin sees, the longer the brown spots are going to persist, and then the harder it is to treat the strawberry legs. One that I absolutely love and will use on a regular basis in the summertime that I find it to be very lightweight and fast absorbing is the one from La Roche-Posay, their Anthelios Melted Milk, and it comes in an SPF 60 or 100, which is even better if you're going to be swimming or sweating or being somewhere out and about for long periods of time. And that one absorbs really quickly, it's really lightweight. So even if you're prone to a little bit of acne that may be contributing to that strawberry leg appearance, this is a great one to consider as a body sunscreen. And I also use it for face too, but a great one for the body. Okay, now let's talk about certain habits that you may be doing, especially when it comes to shaving, hair removal, because certainly like addition of shaving bumps on top of your keratosis pilaris can certainly add to the appearance of strawberry legs. So what you want to do here is, number one, if you have a pre-existing KP, make sure to treat it. But when you are shaving, make sure, number one, you're using a good quality blade, and make sure to change that out frequently. Make sure you are using a shaving cream to lubricate your skin. You may even want to further consider using like a single blade. It may not be as effective for hair removal, but you're only going over once with a single blade versus multi-blade will kind of shave your skin with each blade, and therefore can lead to more skin damage, irritation, and shaving bumps. You can also consider other methods of hair removal like chemical depilatory creams, for example, like Nair. Laser hair removal can certainly be helpful. For some individuals, waxing too, but remember, if you are prone to shaving bumps, which is slightly different than keratosis pilaris, the fact that you're traumatizing your hair follicle with waxing because you're literally pulling the hair out of its root can be irritating. But regardless of the form of hair removal, always make sure that, especially after shaving, that you apply a nice and nourishing moisturizer to your skin immediately to help soothe your skin, so that way you don't continue to get breakdown skin barrier, irritation that therefore can worsen the discoloration and your keratosis pilaris. Now, if you also are prone to shaving bumps on top of keratosis pilaris, a couple of things you can do to maybe minimize the shaving bumps. So making sure your razor blade is new, using shaving creams, moisturizing after, but certainly doing a little bit of exfoliation to the areas that you're shaving on a regular basis. If you're not using a product like lotions I mentioned earlier, but like exfoliating like a few days beforehand can certainly help to remove some of that dead skin buildup that can potentially contribute to inflammation and then ingrown hair that may come with just the shaving. This is not a video about how to reduce shaving bumps, obviously commonly mostly in men in the beard area, but if you are interested in me making a separate video on how to tackle and prevent shaving bumps, please let me know in the comments below. I'd be happy to make one for you. But essentially, using an exfoliant a few days before when you shave, and this could be either the face or even in like private areas, can help to minimize the development of shaving bumps. Now, on the topic of exfoliation, one thing I do want to point out is that when it comes to exfoliation, the more gentle, but even more importantly, more effective way is to use a chemical exfoliant. This is where if you are noticing the keratosis pilaris on your skin that's rough and bumpy, going in with a loofah, with those gloves, or even like a body brush could potentially just cause more damage than good, because you're really being aggressive in removing that top layer of the skin that can cause more inflammation, can cause more potentially spread of bacteria if your tool is not clean, and also just causes redness and break down the skin barrier that, if done inappropriately, can again lead to more hyperpigmentation. So if you don't like or don't want to use an alpha hydroxy or beta hydroxy acid based moisturizer on a regular basis, you can certainly consider like exfoliating pads that are going to be more gentle than scrubs or loofah that also contain a chemical exfoliant, and you can use that on your legs regularly a few times a week. And one that I've been recently trying out, one from a Korean brand called Medicube. It's called their Red Clear Sticker line that contains alpha hydroxy acid, beta hydroxy acid, as well as polyhydroxy acid and niacinamide. It's just a pad, comes in a pretty large volume, and you actually pour the exfoliant into here to create your own basically exfoliating pad in a jar, and you would just apply it to your skin. It's almost like a chemical exfoliant peel, and you would just do this maybe a couple times a week and then just rinse off in the shower. So this is going to be a more gentle way, and you're certainly going to help remove some of that dead skin physically when you're using the pad by just rubbing the pad on your skin. But this is going to be way more gentle and effective than using a physical exfoliant. And then another benefit of using a chemical exfoliant, like I said, my favorite is still probably going to be in that moisturizer form, just because you get so much more benefit. But the other reason why is if you are struggling with hyperpigmentation, alpha hydroxy acid is a great ingredient to help with skin brightening and removing that pigment that it's developed from irritation or what have you. And so that is the other benefit of why I personally recommend a chemical exfoliant over a physical one. Now, let's say you have, really improved your skincare, the way you care for your skin, you're using an exfoliant or body moisturizer on a regular basis, but you're still struggling with mostly the brown spots. What can you do? Well, certainly here, you can definitely use a lot of the brightening products for your face on your lower legs. I think the issue with that is it can be pricey because often they come in smaller jars or bottles, and if you have a large area that is brown and red in color, you inevitably will go through a product very quickly. But like I said, this is a great way to repurpose products that you don't care for on your face for your body if they are brightening or lightening products. One product that I've been using myself, because I've been trying to recover my post-inflammatory marks from just some of the bug bites that I gotten this summer, is from Paula's Choice. And this is a specific body product to help brighten and reduce some of the pigmentation. And it's their 5% niacinamide body serum. In addition to niacinamide, 5% niacinamide, this also contains panthenol, vitamin B5 that's more soothing and supportive of the skin barrier. So this is actually really light lotion that you can put on once daily to help slowly and more gently improve the uneven skin tone on your body. Another one that you can try that I think is fairly affordable and worth trying is a retinol body moisturizer from Versed. That is one I've tried in the past, and this is just another one that's just more affordable, comes in a larger bottle that's more appropriate for use on the body. And retinol also can, like niacinamide and alpha hydroxy and beta hydroxy acid, slowly help with uneven skin tone on the body, in addition to other anti-aging benefits. So that is a very quick video on strawberry legs, how to treat and prevent. Let me know what other topics you would like me to tackle. The next one I could talk about are like shaving bumps, because that's another frequently asked question and concern. I certainly would love it if you could give this video a thumbs up and follow me on YouTube as well as my other social media channels. And I will see you guys next time. Bye.